We are still in the middle of a battle against the coronavirus, but there have been some positive signs in recent weeks. The governor announcing the lowest daily positivity rate since November 25th. That's today. We're also seeing a similar trend here in central New York as well. Right now, we want to bring in Cayuga County Health Director Kathleen Cuddy joining us live. Kathleen, good to see you again.
Thank you. Good to be here.
As we mentioned, the caseload, new cases, active cases, quarantines, all those categories have been coming down quite a bit for you in Cayuga County. Anything you can put your finger on, or is that just the way the trend is going here?
So that's the national trend that we're seeing. I will mention, however, that yesterday and today we're starting to see the effects of our Super Bowl gatherings, and so we'll see our numbers go up a little bit in the forthcoming days.
I guess, you know, obviously a very good reminder for people that, you know, there may always be something to do, right? First it was the holidays, then it was Super Bowl, then there's Valentine's. I mean, there's always something, and we're not in that position yet to start doing those kinds of things. Indoor dinners with family and friends and parties and things like that yet, are we?
Correct. The virus is still out there. The virus is still very prevalent. We get calls every day from businesses that say this is our first case. You know, that's good that it's taken this long, but it's not good that there's someone positive. And we know that we're heading into a school break, and we're aware that there are people who wish to travel during that time because they may have received some vaccine, and you still have to be cautious.
I know this is an incredibly difficult part for all of you in public health these days. I mean, while fewer people are dying from COVID, in particular Cayuga County, I mean, people still are. I mean, you reported some within the last few days. I mean, stark reminder to people again, remain vigilant when it comes to this virus.
Remain vigilant, pick up on the early signs, stay home when you're sick, practice your preventive factors. And I think not only do deaths continue to happen, but there are some very serious health consequences from having this virus, that just because you may have finished your isolation or your infectious period, you still have some very serious illness to contend with for your own personal health and well-being. We see that with pneumonias. We've seen that with pulmonary embolisms. We've seen that in a number of situations. So the disease lingering is just as significant in the effects that this virus is having on people.
I think a lot of people like to think that this is, you know, you get it 14 days, mild, they're severe, they're light, they're none at all symptoms, but 14 days, I'm done, I'm good. But you're clearly pointing out, obviously, that there are certainly could be lasting effects of this virus.
Correct.
How has, let's turn our attention to vaccination, because that's certainly going to help a lot of people. How's it been going in your county? What are you getting shot-wise? Who are you vaccinating right now?
So we're vaccinating the 1B eligible population that the governor's office has requested be done of health departments. We've had great turnout. We're working very closely with the employers to coordinate the vaccination clinics and fill them. We will also be opening up as requested for people with underlying health conditions as they qualify. So we'll see more vaccine comes our way. We'll have more first dose clinics, and we are rolling into our second dose clinics at this time.
Perfect. Let's talk about Snowbirds, because eventually they will be coming back here. There was one set of guidelines. Now it looks like New York State has changed that a little bit. So what should people know? Maybe they're watching us online. Maybe they have a relative who's here and is going to tell them about it in Florida or wherever they are, Arizona. When you come back here, what do you need to do?
So the number one is to not be symptomatic, right? That's regardless of what your vaccination status may be. If you are symptomatic, address those symptoms, because even if you've been vaccinated, there is the possibility still that you could be impacted by some other type of virus or a different variant of the COVID vaccine, or excuse me, of the COVID virus. But the governor and Commissioner Zucker did announce that they are going to adopt the CDC regulations for New York State, which means if you are 2 weeks past your both doses of your vaccination and are fully immunized, then you may be able to prove that to your local health department and then not have to be in quarantine.
Okay, so that's, you know, for instance, if I vacation, I spend the winter in Florida, I've had my shots, 2 doses down there, 14 days later, I'm good. What if I spend the winter in Florida, but I haven't got any of my shots down there? I probably wouldn't want to get one and then come back up here, but you haven't gotten any of your shots. Now what do you do?
Then you're subjected to the travel-related quarantine, and there is some testing that should be done prior to entering New York State, and then after you come back into New York State, if you wish to shorten your length of quarantine time. But if not, then plan to quarantine for your 10-day status while you're in New York.
Maybe I can get one more in here. We know that high-risk high school sports, the vast majority of them anyway, have been allowed to resume. There was a basketball team in York County, Cato Meridian, I believe, that's had to go on pause because of a couple of positive cases there. Any effect on anybody? Did they play anybody yet? Any effect beyond just that school district? And is it just the two there?
So as far as we're aware, and according to the superintendent, it was only their particular home team that was impacted. They were during their practice sessions. But, you know, I think this goes to the fact you just have to be cautious. All the superintendents and most of the community, you know, want to see school back in session, and academics of school are the priority. Sports are an extra, and so we just have to be very careful and continue our preventive measures to the extent possible.
Cayuga County Public Health Director Kathleen Cuddy, thanks so much for joining us again tonight. Really appreciate it.
Thank you.
Christy?